In this case, what we have about 10 to 15-year-old implants with screw and restorations with the bridges on the posterior teeth. And there is a problem. The patient has extreme power functions. He is a bruxist. He wears off all of his teeth, breaks down all the bridges. A lot of problems, and we always have problems with the bridges because the bridges are not holding the pressure, the amount of force he is applying on them. So what we wanted to do in this case, we wanted to remove some part of the gingiva between those multi-units that you can see to make the bridge a little bit thicker.